I'm Dr. Dave Candy, and in this video, I'm going to tell you about two different types of flat feet, how to know which kind you can fix, if you really need to fix it, and how you can fix your fallen arch so that you can walk more comfortably without foot pain, knee pain, or hip pain that may result from having flat feet. Now, if you find this video helpful, give it a like and subscribe to our channel. We help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So first of all, what are the two types of flat feet? Well, there's a structural flat foot, which means the bones of your arch never formed. So you were born with a flatter foot, and it just never formed as you were developing and as you went through your life. And that is a structural thing. A lot of times it is genetic. Your parents may have had it, or your grandparents may have had it, and that does tend to run in families a little bit more. And that type of fallen arch is not really a fallen arch. It's actually something called pes planus. If you take a step on the ground, you'll see that your foot just basically makes a blob. There's no arch where it comes up. And that is a structural deformity that's been there all your life, and it's fairly normal. About 20 to 30% of the population has flat feet. So having flat feet is not all that abnormal. And if roughly 1 in every 3 to 5 people, or about 1 in every 4 people has it, it can't be that big of a deal. And in a lot of cases, it isn't. For people who have a structural flat foot, a lot of times they actually don't have pain. And if the rest of your body throughout your life has developed to compensate for that flat foot, you may have formed your bones as you were growing up in different alignments to where your other bones are in normal alignment when you have flat feet. And if you correct the flat foot problem, so to speak, you may actually start to cause problems in other areas because you're throwing them out of the alignment that they've been used to being in. So if you have a structural flat foot, meaning that it's flat when it's off the floor, it's flat when it's on the floor, it's flat all the time, and it's been there for quite a long time, probably all your life, chances are you probably don't need to fix your flat foot unless it's starting to cause you pain. So this is a case of if it ain't broke, don't fix it. Now, the second type of a fallen arch is truly a fallen arch, where you have an arch in your foot when it's off the floor, but then when you put it down on the floor, your foot flattens out. And that's more of a functional flat foot, that structurally you do have an arch in the bones of your foot, but when you put your foot down on the floor, you overpronate or flatten your foot too much. Now, your foot needs to serve two major functions. As you're loading weight onto it, it should absorb shock. So for example, if you're walking, or even more so if you're running, when you load weight onto your foot should pronate or flatten down just a little bit in order to help act like a shock absorber. But it can't stay there for too long, because when you go to push off, it has to come back the other direction into supination to become a rigid lever so that you can push off your big toe to take your next step. And so in order to do that, your arch and your foot have to work in a proper dynamic so that it's flattening just a little bit, but then it comes out of that quickly as you go through your walking cycle or through your running cycle. So if you do have a functional flat foot, that is a type of flat foot that you can fix, and is probably advisable to do so that the rest of your body works in proper mechanics. That if you have too flat of a foot, it drives your knee inwards, which can cause knee problems. It can cause IT band issues in your hip. It can also cause rotation in your lower back. So if you're having a flat foot that's functional because you're an overpronator, that is a type of problem that you should fix, and I'm going to show you how to do that right now. So first of all, what you want to look for is what is the proper alignment for your foot to be in. And to know that, put your foot on the floor and go all the way into pronation. Go inwards as far as you can. Make your foot actually as flat as you can possibly make it. Your knee will go inwards as you're doing that, and then go all the way the other direction. Go as far into supination where your foot comes up this way and your knee goes out, and then find a mid-range in between there, halfway between all the way in, halfway between all the way out. And when you find that, your knee should be roughly in line with your foot for the most part. Now, if you look down at where your foot arch is, if I do that, this is all the way in, all the way out, all the way in, all the way out, halfway in between. And you'll see there is an arch there, but you'll also notice that my big toe is up off the floor. And so this is the position that I want to maintain my foot in as I'm walking or running or going about my other activities. So it does help to kind of use your toes to support that arch of your foot so that you don't flatten out too much as you're walking and running and going about your day. So that's one good thing to do, is to strengthen those toe flexor muscles and your foot muscles that sit deep up in your arch to help support your arch dynamically with your muscles. But even just doing this right now, I can feel my foot cramping up a little bit as I'm trying really hard to do this. And this can be really hard to do if you're doing it all day long. And that's where having either an insole or a custom orthotic can help. If you do have where your big toe is up off the floor like mine is, it does help to have something that kind of goes all the way up into the forefoot and supports underneath that big toe. Now, the bad news about that is that a lot of the off-the-shelf orthotics that you get, they just kind of control your rear foot, your heel, and the midfoot, and don't go all the way out into the toe. So if you have that same problem, you may be looking a little bit more at a custom orthotic if you've tried off-the-shelf orthotics and they aren't working for you. So there are options to get those at either podiatrist offices, or physical therapists can actually make orthotics for you as well if they've been specially trained. If you happen to be in St. Louis, we can help you with that here at More for Life. So now, what do you do if you have a foot that has pronated and your arch has fallen a little bit? Well, what happens when that falls is that the arch of your foot, we live in St. Louis here, and if you think of the St. Louis arch, that keystone bone right at the top of the arch, if that were to drop out of place, it would make the arch rather unstable. So if the same thing is happening in your foot, then you want to get that keystone bone pushed back up into place. And you'll find that in a couple different areas. On the inner arch, it's usually two bones, either called the navicular or the one past that called the medial cuneiform. And then on the outside of your foot, the lateral arch of your foot over here, there's a bone called the cuboid. But basically what you want to do is run your fingers along the bottom of your foot and just feel for what kind of sticks out. You'll probably feel a little lump there, and it'll help that it's probably a little bit tender too. So if you find a little lump there that sticks out a little bit, you put your thumb on that lump, squeeze a little bit, and then just use your other hand to kind of bend the arch of your foot around that bone, around that lump. And that helps push that keystone bone back up into the arch and helps reform the arch around that keystone bone. Now, the arch on the outside of your foot, the cuboid, you can do the same thing over here, is put your thumb on it and then fold the fifth toe around it to reform that lateral arch of your foot. Now, you also have an arch that goes over the top of your foot this way. And if you've got sort of a flat forefoot here, kind of bending your foot in this direction can help sort of reform that arch. But then when you do stand back up, you do need to be able to use your toe muscles and your foot muscles to help maintain that arch that you've just reformed. So reform the arch, then train your toe muscles and your foot muscles to be able to hold your arch up. You can try practicing balancing on one foot with your arch lifted, which, as you can see, is rather hard to do. It's much easier to do it if you have shoes on that have some arch support, but it can be kind of difficult to do in barefoot. So those are the tips to relieve a functional fallen arch or a functional flat foot. So hopefully you did find those tips helpful. And if you need more help for a flat foot and you happen to live in St. Louis, just contact us at More for Life and we'd be happy to help you. And if you're watching this video from somewhere else but you found it helpful, give it a like, subscribe to our channel, and share it with others who may benefit from it. Thanks for watching and have a great day.